2NURFM.com, a broadcast service of the University of Newcastle.
And we're joined now by the University of Newcastle's Philip Bolton. And Philip, chronic pain, there's a forum coming up, and is it demand that's driving you to put on this forum?
Yes, we're holding this public forum on chronic pain. It's part of an activity that the Priority Research Centre for Translational Neuroscience and Mental Health, together with the Hunter Medical Research Institute group, are doing to engage with the community, to inform them about the research that we're undertaking and to assist them in understanding this significant problem for the community. Your listeners may not know, but about 1 in 5 Australians actually suffer from chronic pain, which in fact can cost the community about $35 billion, that's B for billion, dollars a year. It's a major problem. And here at Newcastle, we're part of the national, international teams that are trying to understand better what's going on and how to better help these people.
So we know how much we have an idea of how big chronic pain is in the community. What aspects are you going to be looking at?
Well, in this particular public forum, we'll have 3 basic scientists who are just some of the people that work in the Newcastle area who will report on some of their work and how they go about their work. We'll also have 3 clinicians who are involved in the management of patients with chronic pain. And one of the challenging topics to the end will in fact be what the patient's responsibility is in managing their chronic pain, because it's not a simple matter.
Okay, so there are a number of avenues, presumably, that you look at when somebody comes along who is suffering from chronic pain.
Yes, in fact, part of the challenge is to understand how the nervous system is working in chronic pain, and it's recently, with the research that's coming from various sources now, become quite clear that actually the brain and spinal cord are changing, and it's now being advocated that actually chronic pain may well be, in its own right, a disease that needs a very different approach to it than we used to think about.
How will that affect our approach to it?
Well, I think it does raise the issue that we need to be very careful to make a clear diagnosis about what the person's problem is. Having made that diagnosis, of course, then it is probably best that a multi-team approach be used, and simply taking painkillers may well put the person on a route of very poor outcome rather than what could be achieved by this multidisciplinary approach.
So in some cases you'd be looking at not just relieving pain with painkillers, but helping people work through and get over the chronic pain? Oh
yes, look, people who are suffering from chronic pain often have a very complex underlying mechanism. As I said earlier, partly because of changes in the nervous system and so on. It's also partly because of the associated disabilities that arise, and of course there's often depression associated with it. So it's really a matter of looking at all of those aspects of the person who's suffering from chronic pain and supporting them in all those regards, and giving them the strategies to be able to live with their pain so that they can get quality of life back.
So you're covering a lot of these aspects in the forum on Thursday night?
Yes, Thursday night, as I said, we'll have 3 people presenting about some of our studies to understand basic science and how the brain and spinal cord are working and how we go about understanding that. And then, of course, there'll be some clinicians who will talk about what happens at the interface between the practitioner and the patient in trying to help the patient live with their chronic pain.
So who would you like to come along to the forum?
Well, I think anybody who's interested in understanding what's going on with chronic pain should consider coming along. I think we're in a position to be able to not only give some information about what we're doing here in Newcastle. There will be about a 30 or 40 minute Q&A with each of the individuals who've presented, available for questions after a little break from the formal part of it. And I think that'll be helpful to people to actually look at some of the questions. And they may be some questions about physiology and anatomy and function and what goes on. On the other hand, it may be about how their care's going and how would they progress or proceed with their own situation.
So you would expect people who are suffering themselves from chronic pain, or perhaps somebody, a family member or a carer, to be interested?
Absolutely. I think clearly there'd be an interest from those that suffer from chronic pain, but it's often a struggle for people who are trying to support family members and live with family members or friends who have chronic pain. And so they may find that as a support person, if they were to attend this, they may get some insights that would help them understand that what their friend or family member is undergoing.
And it's on Thursday night. What time?
Yes, it's on Thursday night. It starts at 5:30 p.m. and we expect to bring it to an end about 7:30 p.m. be in two parts, as I said, some formal presentations, and then, of course, a Q&A afterwards. And we'll have a little break between the two, and there'll be opportunity to chat. And we're going to have a little display on there that might also be very informative for people to run during that break.
And where do we come?
Well, the centre will really be looking at using the Royal Newcastle Centre Lecture Theatre at the John Hunter Hospital campus. So for those that are familiar with the John Hunter Hospital, you'll know you come off Lake Road, there's a big roundabout, and to the left is the parking and so on, and then the John Hunter extends along the ridge. Well, it's that very first part of the John Hunter Hospital that represents the Royal Newcastle Centre, and we'll be in there, and it'll be well signposted for people to attend.
And can we find out a little bit more about the seminar beforehand?
Look, I understand that if anybody's interested in getting more details or indeed wants to secure their seat, they can do one of two things. They can either send an email to an address I can give you, or alternatively they can make a phone call. Perhaps the phone call is the quickest and easiest.
Why don't we have the phone?
Okay, so it's, of course, Newcastle area 02 area code, and the number is 4033 5706. And if you ask to speak to Annalise Johnson, and Annalise will be happy to give more details about things.
That's the Chronic Pain Forum this Thursday at the John Hunter Hospital's Royal Newcastle Centre Lecture Theatre, and 5:30 is the starting time. And the phone number again, 4033 5706. Thank you very much for joining us this morning.
Thank you.
Associate Professor Philip Bolton from the University of Newcastle, Health and Chronic Pain.